It depends on person to person, severity of PCOS. People are conceiving in 1 month only. Okay, after following for 1 month, they are losing about 3 to 4 kg of weight, and they're conceiving. I just wanted to start with this, not directly going into the topic. So in today's age, there is really no shortage of information to those who are looking to transform their health. However, what is truly important for success is a proven system and right support and right culture, actually.
Very true.
Right? So a health coaching program that incorporates a right system with right support. It is crucial to make sustainable changes in your lifestyle that leads to long-term PCOS reversal and chances of natural pregnancy. So my treatment process includes 6 steps. Okay. So basically, I'll be addressing all the root causes of PCOS. I have explained about the root causes in one of our sessions.
Right.
Right. Yeah. So first step would be improving our gut health.
Yes.
And then my personal consultation, where I will be taking a detailed history and giving them a personalized prescription with all the supplements, required supplements, okay, vitamins and minerals and all. Then resetting the biological clock which got disturbed, right? Then movement is equally important. So physical activity, yoga, workouts, PCOS specific workouts should be included. That I will be providing. Then emotional balance is equally important. So emotional imbalances lead to cortisol, melatonin imbalances. So that can contribute to PCOS. Then clean surroundings, as I told, environmental estrogens, xenoestrogens, plastics, beauty products, and cleaning agents. So we'll be addressing all these things in a systematic way. So we need to address the root causes to boost your fertility naturally. So by healthy gut microbiome. So healthy gut microbiome is essential for healing PCOS as part of root cause number 1. So for that, you need to eat differently and you need to eat for your gut microbiome. It's not just calorie counting. Okay, calorie counting is not going to work in PCOS. We need to feed our gut microbiome. So what to eat? So eat mostly plants. Okay, plant-based foods are good for PCOS. Plant-based foods are anti-inflammatory in nature. Eat rainbow. So the salads should be colorful. Okay, so different kinds of colors. The phytoestrogens, those are very good, helpful for PCOS and gut health. Then eat organic. So nowadays there are, you all know that pesticides are so much in our vegetables, and also try to go organic, but it is not possible or not practical to many. So you can at least soak those vegetables or fruits or leaves in the water mixed with little bit of salt and turmeric for about 20 to 30 minutes. That will kind of better. That is better than eating directly. Okay. Then eat raw and minimally processed foods. So nowadays we are getting so many varieties of highly processed foods. Even we can say these pizzas and burgers, these are highly processed actually. All packaged foods are highly processed. So what do I mean by minimally processed foods? Are like cooking and eating. So the foods, how they look when they are harvested, we should eat that kind of foods only. For example, cornflakes is it's a processed food. We cannot see any corn in cornflakes. So total shape is changed actually. So that way, that kind of foods we should not choose. So we should eat like the way our great grandmothers ate when these new foods are not available actually. So raw foods are important and minimally processed foods, and eat whole grains. So white rice, uh, strictly speaking, should be avoided because it doesn't contain any nutrients and no fiber, no B complex vitamins. So that is not benefiting us anyway. So, for example, I told whole grains. So many varieties of whole grains are there in the society, like in the world. So try to use all those grains in a systematic way, actually. And lentils, okay, lentils, any kind of lentils or legumes, all these are good. And beans are also very good. So including beans on daily basis helps uh, in improving your gut health, because beans contain good amount of fiber. So that is helpful for PCOS, and it's good source of protein, actually, plant-based protein. Then coming to exercise, we usually do exercise to lose weight, right? But
Yes.
actually, by exercising, so many things happen. It improves the variety of gut flora. So not only eating, but even physical activity helps in improving the gut health, actually. And it reduces inflammation and improves metabolism. It reduces insulin resistance as well. Then about 20 to 30 minutes of jogging in sunshine. So I am mentioning jogging because walking is not considered as a big exercise, actually. So it is just a physical activity. You can do like walk jog, okay, 5 minutes walk, 1 minute jog, or 5 minutes jog, 1 minute walk. That way it is more beneficial. Then consistency is very important. So doing exercise for 1 or 2 days in a week is not going to help. Even 3 days not going to help. 5 to 6 days should be done. Then physical activity in between the meals. So it's not that only in the morning we do the workouts, and that is enough. For about 40 to 1 hour, 40 minutes to 1 hour, we do exercise in the morning. That is not enough, actually. So throughout the day, our physical activity should be there. At least, like in between meals, we should go for just a walk for 10 minutes. That will make a lot of change. So how to improve your circadian rhythm? It is a second root cause of PCOS. So get some dose of morning sunshine for about 20 to 30 minutes. So this will have impact on our clock, okay, master clock, biological clock. So, and also evening sunshine. Also, if you really have time, it's always good to connect with nature, actually. At least in the morning once is enough. Then eating dinner before 7 p.m. also comes under setting up of the rhythm, because our gut bacteria can sense when we eat. If we eat late in the night, it thinks that that is a daytime, and it sends wrong signals to our organs, actually. Gut bacteria has lots of functions. One of the functions is release of hormones also, and it signals, it has relation to all organs, liver, pancreas, even our master clock. So we should keep in mind at what time we eat. Should not eat after 9 p.m. Then dimming of lights, so you, and avoiding of blue lights. Nowadays it is also so common, needless to say, that we are watching the screens in various forms. Mobiles, laptops, TVs are there, no? So Netflix, so many so many interesting movies and series are there in the Netflix. So it is not so practical, not so easy, but we have to um, change the timings, or whatever works with you. You have to make some changes. You can use any blue light filter glasses also, if possible. So do something, but see that your sleep timings are proper. Why this is very important is the melatonin hormone, which is very good for egg quality, will start that starts rising from 6 p.m. onwards, and it peaks at 2 p.m. 2 a.m. midnight 2 a.m. Yeah, so this time is very, very important for female health, actually. So proper egg quality. So that period of time, it is getting disturbed nowadays, actually. So if you're really serious about improving your health and coming out of PCOS, you can experiment this for about 3 months and see the results. And follow the sleep hygiene. Even we can replace the red and orange light, like replace your white lights in your home with the red and orange lights. Also, you can use the digital lights also. You can set a timer, and that gets switched.
What are red and red lights?
See, like in our home, we will have tube lights, which are the white lights. Those can be replaced with any orange lights. In bathrooms, if we have a blue lights, white lights, okay, that can be replaced with any red or orange lights.
What are the
So
red
that
orange lights like?
color, it's just color
Oh,
of
just the
the,
bulb color.
yeah, that's it.
Okay.
Bulb color, warm lights.
Okay.
The lights should, yeah, if possible. Otherwise, that's okay. Yeah. Then sleep in complete darkness or use a sleep mask. This is also equally important because even slightest amount of light entering your bedroom, that will increase cortisol levels. Cortisol is a stress hormone and reduces the melatonin levels. So we should take care of that also. And maintain proper sleep timings every single day. We can even set an alarm for sleep timings also. Usually we set alarm for waking up, but
Yeah.
we can set for sleep timings also. So every day, sleeping at the same time, waking up at the same time, it makes a lot of difference. That is what circadian rhythm is. Then sleep for about 7 to 8 hours every day. Okay. So now, how to improve your metabolism? Metabolism is nothing but how we utilize our sugars, fats, and proteins. Okay, so if they are utilized in a proper way, in the way they are supposed to be utilized, no problem will be there. So because we are unable to utilize them properly because of accumulation of fat in the cells, we are gaining weight. Okay, so metabolism is all about gaining and losing weight, right? So how to improve? One way is fasting. Okay, so there are 4 types of fastings. Intermittent fasting, we all know 12 to 13 hours of fasting in the night is a basic type of intermittent fasting. This number can be increased actually, but for women who are planning to conceive, the intermittent fasting hours should not exceed 14 hours.
Okay.
Maximum 14, because our body feels that there is some starvation is going on, and that will shut down our reproductive system.
Oh,
Okay, kind that way, it feels that way. So nutrition is important basically, right, for those who are planning to conceive. So 12 to 14 hours of fasting, we can say. Then no snacking in between the meals. So usually some programs, they ask to eat small meals multiple times. Rather than doing that, having substantial meals, big breakfast, lunch, and dinner without any snacking in between the meals, that helps to improve the metabolism. Okay, that will convert your metabolism from sugar and fat storing to sugar and fat burning by the next meal. Okay, then 24 to 48 hours water fasting also you can try, or juice fastings you can try. Then 5-day fasting mimicking diet. I help them doing this in my program. Yeah, so we are done. So to summarize, feeding your gut microbiome, setting up your circadian rhythm, optimizing your sleep, and cleaning your environments of the plastics, beauty products, and cleaning agents, we can reduce our inflammation, insulin resistance, and hormonal can balance our hormones, and ultimately will be healing our PCOS, and you will be able to conceive naturally.
How long does your treatment go on, Dr. Sreevani?
It's about, ideally, it takes about 3 months.
Okay.
But it depends on person to person, severity of PCOS. People are conceiving in 1 month only. Okay, after following for 1 month, they are losing about 3 to 4 kg of weight, and they're conceiving actually. Sometimes in second month they are conceiving. Actually, I advise them to use contraception for at least 2 months. Don't conceive, but sometimes it is happening. And by third month, within 6 months, definitely many of them would be conceiving.
So what's the idea behind using contraceptive for at least 2-3 months when they're treating?
Because their body is not yet ready, and the inflammation and insulin resistance is still, it's not completely gone, and the quality of egg may not be so good if they conceive, and they may land up in miscarriages.
Okay.
That's
So this is just like a preventive measure so that you
yes,
optimize your pregnancy in the long run.
yes,
Well,
yeah.
Dr. Sri, in a time when people are looking for shortcut answers and solutions, you're going back to basics and teaching people how to go about things in a more systematic and natural way. And I'm sure you've gone ahead and helped a lot of couples.
Yeah, so many.
Wow.
So many people got benefited and they're so happy. They are enjoying their healthy pregnancy,
Yeah.
not like others, like always thinking what would happen, diabetes in pregnancy, hypertension in pregnancy. They are not having any such sort of things, and they are enjoying their pregnancy. And many are delivering by normal delivery. Like usually, uh, people are landing up in cesarean section because they are not so fit to push their uterus. Their uterus is not so fit. Now, in after following our program, they are undergoing normal vaginal deliveries also.
Very nice. So that's one question that I have always been asking for some time. It seems these days more and more people are going for cesarean birth. Why do you
Yes.
think that is? Is this something to do with our forefather era and these days?
Definitely, our lifestyle only matters.
Mm.
And yeah, nutrition is not so good. Our vitamins, minerals, calcium, bones are also not so good.
Mm.
So and, they sometimes they are becoming so sensitive, also unable to cope up that much
Mm.
pains, the
Mm.
labor pains,
Mm.
and they are requesting for cesarean sections. That is also there.
So it looks
most
like,
of the times most
yeah.
of the times the comorbidities are more diabetes, hypertension kind of things.
Mm. So it looks like the more amenities we have, the more tougher the challenge of getting pregnant.
Yeah.
Well, Dr. Sri, thank you so much. So for viewers, normally when you have PCOS, the normal treatment is birth control pills, which is prescribed by the doctor, or you've got insulin resensitizing medication, or you've got medications to block androgen. All these things are being done currently. However,
Yes,
it doesn't really help in the long run. So Dr.
definitely.
Sreevani is going back the basics and teaching us and her followers how to improve gut health, basic lifestyle modification, which leads to long-lasting impact and healthier lifestyle. Dr. Sri,
Yes.
thank you so much. May your passion of empowering more couples go not just within India, but across the world.
Thank you so much.
We at Subak Health Tech cannot thank you enough for all your precious time, all these weeks. We wish you the very best. And please remember, our good wishes and our prayers are always with you.
Thank you so much. And it was so great working with you. Like I enjoyed each and every session. Looking forward for a few more sessions, such sessions in future.
More collaborations, and perhaps we'll go Instagram live. I'm mustering up courage to go Instagram live these days.
Let's do it.
Yeah. God bless you, Dr. Sri.
Thank
Bye.
you so much. Bye bye.